it's not the way to go. So
I have 3 out of 6, we cut up all their food really finally, just because, you know, they're getting older and they can't eat without somebody at the table with them. One
Yeah.
of the staff has to be sitting at the table. Because I have one client who's been choking.
yeah, and the minute they're choking, that's your indicator to get them to a doctor, get the formal eval, you know, so that you have these guidelines you're following. You know, puree is not the end of the world, and I know your facility it has blender. So by licensure, you should be able to provide, you know, the puree. Puree is not the end of the world. I had throat surgery a few years ago, and for 6 weeks I had to be on a puree diet. I couldn't eat for the first 10. I could not swallow for the first 10. But following that, for 6 weeks, I was on a puree diet. And I came back to work, and I'm the first patient that complained to me about the pureed food. I went crazy. I said, this, you know, what you make in your kitchen, you can puree that client's portion so it will have all the same delicious herbs and gravies and sauces. It's just in a different textured form. And there is less opportunity for asphyxiation with puree than there is with solids. There's some doctors will tell you you cannot asphyxiate puree. I beg to differ on that. I think if you have, I've seen shovelers get into trouble really shoveling puree. But that said, there's less, if puree, if it does get into the airway, it would tend to go into the lung, and yeah, you're still gonna have to get them to the hospital, and you're gonna need antibiotics, but there's gonna be less opportunity for a big amount, such a large amount, to come into the airway to block it. Jello. I didn't put Jello in my notes, but Jello is the great killer, I call it, in our hospital. Not that, I don't give Jello to anyone that has a swallowing problem in all my hospitals. What Jello does, you need a lot of pressure to push Jello through here. And when you have swallowing problems or a weakened base of tongue, you don't have a lot of pressure through here. And so Jello will stick in here, and then it starts to melt, and it drips sugar water into the lungs. And as we get older, we lose our cough response. So if it's, you know, your patients may not be clearing their throat or trying to cough, or your clients rather. And it can block the trachea, and trust me, the Heimlich doesn't clear it. So, because it's so sticky and it sticks against that wall. So if you're using Jello with your clients, be very, very careful. Additionally, there's no nutritional benefit whatsoever to Jello. It's just sugar water. You know, we use it on our surgical unit, but that's about it. Do you use Jello?
We do. And you know, as you're talking, I'm thinking to myself, you know, I think we've definitely given Jello to people that we thought may have swallow issues, thinking it's soft and it's something easier to swallow. So it's interesting to hear that it's the worst.
It really does not
Wow.
melt very easily.
Yeah.
So, any other questions? All great questions. I wanted to just talk about, we talked about the diets a little bit. We talked about mechanical soft, and you can either chop the meats finely and add a little gravy, chop the whole plate, add a little gravy, or you can grind the meats so they resemble more of cottage cheese. That's another way to kind of get around risk with choking. You would probably at that point want a swallowing evaluation so that the speech pathologist can help guide you in that and those decisions for your client. And then we talked about pureed foods. But then liquids are the other thing, and liquids are, we also modify for folks that have swallowing problems. So most of your clients are probably drinking any type of liquid. We call that thin liquids. But if we need to add thickener, we call that two versions, a nectar thickened liquid or a honey thickened liquid. Nectar thickened liquids are like V8 juice, Kern's nectars. They have a little more body. What you want to do, why we as speech pathologists change liquids and make them thicker, is that we want to match the slowness of the liquid to the slowness of the swallow. Because if the liquid is moving faster than the swallowing muscles are moving, you're going to get a splash of liquid into the lungs. And maybe more than a splash. It may be continuous pouring. And again, as your clients age, they may or may not have a cough reflex, because that does tend to extinguish with time. So this is the thickener product that you use here, correct?
Yes.
Okay. And juice. Do y'all thicken, or have you all had experience thickening liquids?
Not everyone, but some.
One thing I want to draw your attention to with the thickener, it's critical to know. The recipes on the can for the powdered thickener are sort of generic recipes, but every liquid thickens differently. Cranberry juice thickens faster and more densely than apple juice does. Tea thickens differently than any of the cold juices. Soda explodes when you add this to it. So you just kind of need to be aware of all of this and go in judiciously with your spoon.
That's right.
Yeah. The other thing is that powdered thickeners continue to thicken with time. If your clients are hospitalized at any of the local hospitals in Marin County, acute care hospitals, they may come home with a Simply Thick carton. And Simply Thick is a new gel-based thickener that the acute hospitals are using in Marin. And with this one packet thickens 4 ounces, so not an 8-ounce cup, and this does not continue to thicken. So this is almost a different process. So I've had some calls from a couple of group homes recently saying, but the thickener that you sent them home with isn't working the way we're used to. So I just wanted you all to be aware. I'm glad you brought this, Rob, because I brought some too. Powdered thickener thickens very differently than gel thickeners. Powdered thickeners will continue to thicken. So if your client is on a nectar thickened liquid, by the time they finish their meal, they'll be drinking honey. So if they're really resistant to the thickness, it may be because it's thickened too much and you might need to just keep adding water or a little more juice to thin it out and keep stirring it. And then they'll get back into the drinking of it. I'm
So
sorry.
in that process, how would one know if they've gone too far in the thin scale?
Okay.
Part of the scale.
If it's, again, keep V8, does everyone know what V8 juice looks like? That's what I always tell my families and other caregivers when I give these talks. If it looks like V8 juice for nectar thickened liquids, you're in the right place. Because that's the most consistent, like that tomato juice thickness. Pourable honey, if you know the teddy bear that honey's in, y'all know the honey comes. When you squeeze that out, you see the ribbons of honey. That's what the honey thick should look like. So those 2 mental pictures would be your guiding point. Okay. The other little tip, because this is a beautiful facility, if your client does not finish their drink with the powdered thickener, do not throw it down the drain. Throw it in the trash, because your pipes will clog over time, and you have to get a plumber out. I've had that happen in my office. Okay? Would you like a demonstration on thickening? Or do you feel confident?
Yeah.
Rob says yes, okay. So I'm gonna, sorry about that.
No, no worries.
Little taste test. Okay, so I brought that. I'm going to use powdered thickener. I'm just going to work with the thickener, and I'm going to use 4 ounces of orange juice. And actually, Rob, I bought a smaller.
Oh, great, good. Yeah, that was the only screen I could find when I was trying to access. We don't feed people with us.
Okay, so on your can here, they have directions. So we're using orange juice, and this says to 4 ounces, which is what I poured, for nectar, so we'll go with nectar. This is 3 to 3.5 teaspoons. I personally think that's a lot, but let's give it a go. I think so, yeah. I'm gonna, for sanitary purposes, I'll use this and that's 2. So here's 1, 2, 3. And then this is a stir process. This is not a shake. If your folks come back with the gel product, you have to shake the gel. You cannot stir it. And we have a little electric whisk, or we used to have a little electric whisk in our office to mix this. All right, so this doesn't look so bad. This thickens up really quickly. You can see it's like V8 juice. But by the time I leave, it's going to be pudding. If we wait a little bit, that will turn to honey thick, and then we'll be pudding thick. But, so, you know, you just kind of keep diluting it, you know, depending on how long. What's your average meal time? How long are your clients in here?
30 minutes.
I'm sorry?
For phone calls, 30 minutes.
30 minutes? That's good. Yeah, that's a good amount of time.
Yeah,
20 minutes.
that's our average.
Yeah, I think that's perfect. Anyone that's starting to need 45 minutes, 50 minutes to finish a plate, they need a swallowing evaluation. That's way too long. Start to get behind on the nourishment benefit, and they get really fatigued. Swallowing muscles will weaken more. So
Why do you get behind on the nourishment benefit?
I'm not really sure that, I don't know how to answer that question. But every dietitian I've worked with in 25 years, their standard is 20 minutes. If they can't do it a reasonable amount, about 75%, you know, of their meal in 20 minutes, it has something to do,
I guess you're already starting to metabolize stuff.
I guess so, yeah. I know from a swallowing perspective, about 30 minutes for folks with swallowing problems, you're pushing the envelope on them maintaining strength and integrity in here, and you're increasing your opportunities for asphyxiation events.
What about an extended meal time for someone who has motor skill issues? It's not a swallowing problem, but it's, you know, it's because of Alzheimer's disease and it's very slow and they just take very long to eat. But there's no swallowing
Or
problem.
are they chewing
They're chewing, yes.
and chewing?
Yes. Well, except for
And
not chewing
chewing?
nonstop because there's long breaks between each bite.
Okay, because if the chewing is really long, they're on the wrong diet.
Okay.
But if there's long breaks because they're distracted, then what you have to really do is kind of maximize their intake. And how we do that with dementia patients typically is alter their diet so they don't have to chew as much. These are all generic suggestions. If you look on the second page of your handout, I have referrals and resources listed so that it does give you all a sense of who's out there to contribute to the care of the patient when there is some concern for swallowing. Because swallowing problems have a bigger rainbow of impact on overall medical status than a lot of folks realize. They impact nutrition, it impacts hydration, how much liquid folks are getting in. It impacts, and if those are diminished, then you start to have other body systems start to not work optimally, and then you end up with hospitalization. And it sometimes is the crux of a problem, which is why, you know, so many hospitals have swallowing programs, you know, as an integral part of the treatment. And why when your folks come in very often, when your clients come into the hospital, all the hospitals in Marin County, they typically get a swallowing evaluation on admission. Just to make sure we've got the right diet texture and liquids so that nothing adverse happens, you know, within our setting, and we can maximize nutrition while they're in our facility. Because it's, you know, I know it's very, it can be very catastrophic for someone to be taken from their home and put in the acute care hospital without all of you there, without their familiar surroundings. So, you know, the better you can keep them out of a hospital, you know, better for all, for them and for you. So anyway, just to review, speech pathologists are the professionals that do the swallowing evaluations and they make recommendations, work with the patient's physician. All of these referrals do need to be physician ordered. So occupational therapists are the group of professionals that work with self-feeding. They can offer information on adaptive equipment, weighted spoons, plate guards, different strategies for enabling independence in self-feeding for as long as possible. Physical therapists are great evaluations if you have folks that are in wheelchairs to really maximize positioning and safety within the wheelchair. Registered dietitians, do you have a consultant on staff? Some group homes by licensure have to.
Yes, but it's more of someone that's helping develop menus versus
Okay.
like actually being on site.
Gotcha.
Yeah.
Okay. So dietitians, if your client started to have speech and swallowing issues, we would often work with a dietitian to try and give you suggestions for perhaps how to space meals apart, how many calories. Maybe they need to go to small frequent meals throughout the day, how many calories need to be incorporated in that, how to monitor how much liquid they're getting. So registered dietitians are very helpful, and speech pathologists and dietitians work very closely with folks that do have swallowing problems. And then dentistry, I know dentistry is a huge, you're very, aware of that. If a client has dentures and they don't fit, they need to come out. They should not be worn for eating if they're clapping around in the mouth. Do any of your clients have dentures?
They do, but for the most part, it's not very successful. We have a number of people that have no teeth.
Okay,
And
no teeth works almost better than dentures that don't fit. Yeah, so, and remembering too that dentures, the upper denture particularly covers the palate, and there's a lot of sensory input that the brain gets from food and liquid hitting the palate. So I have care providers that often feel terribly for not putting dentures in their clients when their dentures they've always had dentures, but the dentures aren't fitting well, and they just feel very terribly not putting them in, but the brain needs as much input as possible. And so, don't ever feel badly if the dentures don't fit well, they don't need them to eat. You might have to modify the diet so they can chew easily. Might need to be puree at some point, but keep that in mind.
could you speak a little, because we actually do have somebody that's in that boat, that's on a soft mechanical diet, and there's kind of been some back and forth in terms of perception of what that is. Could you speak about mechanical?
Perception in terms of how it should be prepared, or perception that it's not a quality of life decision?
More of how the preparation.
Preparation, okay. So, the American, I'm not a dietitian, I'm a speech pathologist, but I tend to follow the guidelines from the American Dietetic Association for menu, for preparation of food and how modified textures should look. The state of California also has a breakdown. I don't know if you were bound to follow that one. I would assume so through your licensure. So your consulting dietitian, your consulting dietitian probably has your kitchen structured to that. They're not terribly dissimilar, but meats are the big thing, because meats are really the easiest thing to asphyxiate on. Bread's another story. We'll get to bread. So the meats should be chopped. In our facility, we say meat should be chopped to resemble pencil erasers. Not the big pink pencil eraser, but the pencil eraser that's on top of a standard pencil. So that size, and add gravy. Ground is the next level for meat on a mechanical soft diet, and we say that should look like cottage cheese, so it should have gravy. All meats, when you're dealing with folks that have swallowing and chewing problems, all meats should have gravy. The oral cavity and the pharynx needs extra moisture. So those would be what the meats should look like. Now, there's two schools of thought on vegetables and starches. Some care facilities and some hospitals tend to chop the beans, the green beans, or the vegetables, and they'll chop the scalloped potatoes. Rice is not on a mechanical soft diet. And I have guidelines for you in your handout about all the diets. Rice is very dry and it's very sticky, and